Well, good evening, ladies and gentlemen, and thank you so much for joining us on our coronavirus response town hall, focus on slowing the spread and preparing for a vaccine. We so appreciate each and every one of you being with us tonight. We have several thousand folks who are watching from the Golden Gate Bridge to the Oregon border. We so appreciate you taking the time. My name is Mike McGuire, and I am incredibly grateful to be able to work with you as a member of the State Senate, representing the North Coast from the beautiful Golden Gate Bridge all the way to the shores of the Oregon border. We are so appreciative, especially in these busy holiday times, that you have taken the time to be able to attend this incredibly important town hall that's focused on our region's expanding coronavirus numbers and the vaccine that has now officially arrived on Golden State soil. Let's be honest, our communities, this state and our nation, we are all living in challenging times right now. While there is light at the end of the tunnel because of the vaccines, the next 2 to 3 months here in the United States and right here at home in California, it's going to be the worst. They're going to be the worst of the pandemic. The impact of holiday gatherings is expediting the rate of spread of the coronavirus in our communities. Several regions of the state, including counties in the North Bay area, have seen ICU capacities enter surge mode because all of the traditional ICU beds are full and other Northern California counties are getting close to capacity. We're seeing record numbers of infections each and every day in the state of California. A soaring death rate has taken hold across the United States, and so many of our neighbors are hurting financially. That said, as Californians and as Americans, we need to hold strong. We will get through this, but we need each other more than ever. Especially in this holiday season, we all need to remain vigilant. Our number one tool, besides the vaccine, is each of us. It's more important than ever that we all take action, and spend the next few months keeping on, not gathering in large groups, keeping our distance, and of course, wearing the all-important face covering and mask. Tonight we're coming together. We're going to come together to be able to discuss the next few months with the coronavirus, how we can work together to be able to slow the spread, and how the state of California and our healthcare professionals are preparing for this vaccine. We'll have the latest, most accurate information from the medical professionals literally on the front lines of pandemic response and those charged with the distribution of the vaccine here in California. First, we are incredibly grateful that we have Dr. Timothy Brewer. He's from the UCLA Geffen School of Medicine, one of the state's best infectious disease physicians. And we have one of the best public health officers in the entire nation with us tonight, Dr. Willis. He is the Marin County Public Health Officer. Both of these doctors, they're going to be taking a region-wide view in their coronavirus briefing that we'll hear in just a couple of minutes. And we're also grateful to Lori Nazura. Lori Nazura is the Deputy Director of Planning, Preparedness, Prevention for the State Office of Emergency Services. She also serves as the co-chair of the task force in charge of vaccine distributions for the Golden State. But the most important part of this evening is having a conversation with each and every one of you. We want to hear from you tonight. We want to have that conversation, answer your questions, and address your concerns. If you are on Zoom right now, you can put your question in the Q&A at the bottom of the screen. For the vast majority of you, several thousand who are watching tonight on our live stream, please email us. And if you're on the phone, you can also email us, senator.mcguire@senate.ca.gov. Email your questions, email your concerns to senator.mcguire@senate.ca.gov. If you're currently watching on Facebook, please put your questions and your comments into the comment section, and we'll make sure we get to those as well. And finally, if you're among one of the 2,000 questions that were submitted prior to tonight's town hall, what we want to let you know is we've batched many of them because they were similar in nature, and we will be covering as many as those questions as well. All right, ladies and gentlemen, let's get into it. We are so appreciative that Dr. Timothy Brewer is with us from the UCLA School of Medicine. He's going to be giving us a statewide overview of the coronavirus response and why there is so much concern in January and February. He's going to give us a very brief overview of hospital ICU capacity across our region. He's going to be focusing on the vaccines, what they do, and how they're going to work. He is going to give us his best guess on when we're going to get back to normal and, of course, how he defines herd immunity. Ladies and gentlemen, the floor is now going to be turned over to Dr. Timothy Brewer. Dr. Brewer, good evening and welcome.
Good evening, Senator, and thank you very much for having me. I want to start with a couple of definitions. So I'm going to use two terms. One is SARS-CoV-2. That's the virus, the coronavirus that causes the disease COVID-19. So I'll be using both of those terms. They're not quite interchangeable, but I just wanted to be aware. So let's talk about what's happened since Halloween, because this is really an unprecedented time in the pandemic. So right now in California, we've reported 1.7 million cases and about 28,500 deaths. But what's happened since Halloween is really unheard of. So if we go back to October 30th in California, we were averaging about 4,100 cases a day. Right now, we're averaging about 30,400 cases a day. That's a 740% increase. And in fact, yesterday, we reported over 52,000 cases. Exact same thing is happening with deaths. So if we go back to Halloween, we were averaging about 50 deaths a day. Now we're averaging 173 deaths a day. That's a 350% increase. And we had 379 deaths reported in California yesterday. Same thing, unfortunately, happening with hospitalizations. We've gone from 3,100 people in the hospital with COVID on average to almost 13,000 people in the hospital every single day right now. So about a 400% increase. And as of yesterday, we had 16,400 people in hospital beds in California, 3,280 of them in intensive care units. So what we've seen is just a tremendous growth in the spread of this virus within our state. And we're going to talk a little bit about what we can do about that. Exact same thing is happening in the northern region. Dr. Willis will probably touch on this too, but just to mention, Sonoma County has gone from about 70 cases a day on average back in Halloween to now over 225 cases a day, and from having 28 people in the hospital to having 63 people in the hospital. What's going on? A couple of things. One is we're moving into the winter, and cold weather, low humidity increases the transmission of respiratory viruses, including influenza and coronaviruses, and we spend more time indoors. And that's why the senator is correct that the next 2 months are going to be very challenging for us because of that cold weather, because of the time indoors, and because we're in respiratory virus season. In terms of the ICU capacity, the North is actually doing a little bit better than we are down in the South. So San Francisco's running about 18% capacity. Sonoma County is about 28%, whereas down here, we're actually close to zero. Across the state as a whole, our ICU capacity is running at about 3%. So you can see that we're really stretched to the limits right now, and we have to help each other out to be able to get through this. Let me talk about some of the bright spots. So the first is vaccine. So we now have 2 vaccines that are coming out. One is the Pfizer vaccine, which has already been authorized by the Food and Drug Administration through what's called an emergency use authorization, or an EUA. And the second is the Moderna vaccine, which was recommended by the panel today and will likely be authorized in the next few days. Both of these vaccines rely on messenger RNA. So this is a new technology. We have never had an mRNA vaccine in humans before. mRNA vaccines are genetic codes. They're just little signals that, when injected into the body, enter into the cells, and then the cells manufacture the protein from that code. in this case, the spike protein for the SARS-CoV-2 coronavirus. What happens then is the immune system recognizes that protein as a foreign invader and it generates a protective response. And that's part of why you get the side effects from a vaccine. And we'll talk about those in 1 second. But more importantly, what it does is it primes the immune system so that if you get exposed to the SARS-CoV-2 virus, the immune system is ready to roll, generate a rapid response, and protect you from getting sick. And based on trials, both vaccines offer about 95% efficacy in protecting against serious disease. So that's actually terrific news. What we don't know is we don't know if the vaccines protect against infection. And so that's why it's going to be so important while we roll out these vaccines that we continue to do our masking in public places, we maintain our social distancing, we stay home when we're sick, and we use our hand hygiene, because we don't know yet whether these vaccines will actually interrupt transmission, but great news that they do protect against serious disease. In terms of those side effects, primarily fever, chills, muscle ache, pain at the site of the injection, usually these go away within 1 to 2 days. You can get some swollen glands, and then rarely there have been some severe reactions reported with the Pfizer vaccine since it's been released, 4 cases of anaphylaxis. But in general, the data suggests so far these vaccines are very safe. So Senator wanted to know what the new normal is. Well, I think it's going to be like 9/11. We'll never go back to exactly what we were before. But I think the fact that we have had 2 surges before in California, and we've managed to turn both around by using our preventive measures, and the fact that we now have vaccines that will be available means we can get on top of this if we all work together. So finally, I just want to touch briefly on herd immunity. So what herd immunity is, it's having sufficient numbers of people in a population with protective immunity against a pathogen so it cannot easily spread within that population. And essentially, herd immunity is very difficult to get outside of an effective vaccine. And that's part of why those vaccines are so important. So for example, polio always spread until we had polio vaccines. Now, you can get that protective immunity from either having infection or from being vaccinated, but the hope is that between those two, we'll eventually get to the levels where everybody is protected from the infection, even if they haven't been vaccinated. And that's the goal of herd immunity. And then finally, just to say, we're in this together. And if we continue to do those public health measures that Dr. Wills will talk about, with the vaccine, I think we will come out the other end. Thank you.
Thank you so much. That's Dr. Brewer. Again, Dr. Brewer is truly a gift to the state, one of the best infectious disease physicians here in the state of California. He's been with us since the very beginning. Dr. Brewer, thank you so much for being with us. He's going to be taking your questions, responding to your comments. If you have a question, and we are starting to get dozens of questions here, please email us, senator.mcguire at senate.ca.gov. We'll be getting to your questions, your comments in just a few moments. We're now going to be turning it over to Dr. Matt Willis. He's the Marin County Public Health Officer. He's going to cover and do a deep dive on several focus areas. Number one, the biggest concern. What is his biggest concern moving forward for Northern California? He's going to discuss the safety and efficacy of the 2 vaccines, the Moderna and the Pfizer vaccine. He's going to answer the question that we've been getting a lot of response to. Will the coronavirus vaccine become an annual shot like we do with the flu shot each and every year? Of course, he's going to be talking about the safety of the vaccine and if we're going to need to continue to wear those masks after folks get vaccinated. Dr. Willis, we are so honored that you've joined us. The floor is yours. You have up to 7 minutes, and I'll give you a 30-second prompt.
Thank you. Great to see everyone. Thanks for the opportunity to address this crisis as we're experiencing across Northern California. I think the best way to summarize where we are in Marin and across the region is to describe my day yesterday. which began at the Emergency Operations Center, like most of my days do, since the beginning of this pandemic, 9 months ago, with the arrival of the best holiday gift we could imagine, which was the box of 1,950 doses of the Pfizer vaccine. Our first allocations of the vaccine arrived yesterday morning. We immediately deployed our teams out to our 3 hospitals to distribute that vaccine. I was able to go to Kaiser Permanente, one of our hospitals in San Rafael, and join them in a celebratory event where the first employees, emergency room doctors, emergency room staff were actually vaccinated right then and there. It was an atmosphere of relief, of hope, of celebration, and I really felt different. Everyone felt energized in a way I haven't seen before, with all the fatigue that's been setting in over the past few months. I'm really feeling a new energy here. Obviously, that celebratory atmosphere was tempered by the fact that in that very hospital, people upstairs in the ICU, on ventilators, many fighting for their lives, we're also seeing record surges. So that same day that we had the vaccine, we also had the greatest number of cases in one day we've ever seen. 112 cases in one day in Marin County. Our ICUs are near full capacity. We had 35 individuals in the hospital. May not sound like a lot, but we're not a big county, and that's the most we've ever had. 12 of them were in the ICU. So we're seeing record numbers of cases, hospitalizations, and ICU stays. So that's the dichotomy. That's the contradiction. Right now we're dealing with the hope of the vaccine as well as surges unprecedented in cases. If I have any concerns right now is that the community right now might not recognize how much control we have over this right now. It may feel like we're helpless. We're seeing surges everywhere, but the fact is it is in our hands. If we were able to interrupt transmission in the community as it's occurring every day, we would actually be able to start reducing within a week, within 2 weeks, within 3 weeks, we start seeing hospitalization rates go down. Our ICUs would start relaxing in terms of their capacity. That's what we need. And that's why I think the most important issue for me as a health officer is to try to help our whole community understand how much control we actually have over this. And it's interventions that we've been talking about for a long time. Right now, the biggest contributor to transmission is indoor social gatherings. When we look at the data, our contact investigations, that's the biggest contributor. That's something that we can all do to prevent. Unfortunately, this is a time of year where we do tend to gather together more frequently, and that's our best instincts, right? But this holiday season, if it's about our friends, our family, the things that we cherish the most, the way to do that is to actually do it separately. So that's the image that I have in my mind that I'm most concerned about. What keeps me up at night is people rolling into the emergency departments and not having beds upstairs for them, as we saw in New York City and other places where they're experiencing surges, gurneys in the hallways, and we're not able to offer the standard of care that our people need. But it's in our hands to prevent that. Getting to the vaccine, ultimately that is the solution over time. We're very fortunate that SARS-CoV-2 is a vaccine preventable disease. COVID-19 is vaccine preventable. Not all viruses have a vaccine that works. HIV, for example, there's not a great virus against HIV. Not a great vaccine against HIV. So fortunately, SARS-CoV-2, a vaccine works 90 to 95% effective. The first 2 doses, the first 2 vaccines that are coming out, as Dr. Brewer already explained. We know that Northern California, especially our region, is a famously vaccine hesitant community. When I became a health officer in 2013, only 78% of our children were choosing to be vaccinated, or the families were choosing to be vaccinated against vaccine preventable childhood diseases. We've done a lot of work, and what we've learned in that process is going to be applied to the COVID-19 vaccine. One of the first lessons of trying to help people through navigating those decisions about vaccine was recognizing that decision needs to happen in the context of a trusted relationship with a medical provider. So we're working with our healthcare providers across the county to arm them with the information and knowledge they need to be able to actually have that one-on-one conversation with people who may be hesitant about choosing to be vaccinated and really guide them in that decision-making. This is not going to be a mandatory vaccine. It's something people are going to be offered the choice around, and we want to make them, make sure that people have the best available information for navigating that choice. In terms of the safety and efficacy, big phase 3 clinical trials, as Dr. Brewer mentioned, 80,000 participants in those trials. Very briefly, what they do is they separate them into 2 pieces. 40,000 get a placebo, 40,000 got the actual vaccine. And then they look at what happens over time. And it turns out that those that got the placebo continued to get infections at the normal community rate, and those who got the vaccine really didn't, and a difference of a 90% efficacy. And that's and then now furthermore, the scientific review group that came together and looked at the safety for the FDA has endorsed the safety of both the Moderna product and the Pfizer product. So we're confident in both the safety and efficacy of this, and it's going to be up to us to help communicate to the community that this is something that we're all going to need to adopt. If we get 70% of our communities vaccinated, we're going to be having that number of herd immunity where the virus is not able to actually transmit from one person to another because the next person it encounters might be actually protected. That's our goal, 70%. And if we get there by March, this summer will be a much different experience for all of us. And I think that's.
Thank you so much, Dr. No, you're good, Dr. Willis. So appreciate you being here with us. We're going to take your questions for Dr. Willis, Dr. Brewer in just a few moments, but let's get to Deputy Director Lori Nazura. Lori Nazura is the Deputy Director for Planning, Preparedness, and Prevention for the State Office of Emergency Services. And she is co-chair of the State Vaccine Task Force that's charged with vaccine distribution. It's an incredibly challenging job that she has. She's going to focus on how our vaccines going to be distributed to states and what is the role of the Vaccine Task Force here in California. She's going to talk about timelines and tiers, but I want to be very candid. Those timelines and tiers, they're still squishy because we're also waiting for federal guidance as well, but we'll hear more from Ms. Nazura in just a few moments. She's going to do a recap on this first tier that we're in for healthcare workers, how that's working, and then she's also going to talk about the role that counties will play in vaccine distribution. Ladies and gentlemen, we're going to turn the floor over to the Deputy Director from the State Office of Emergency Services, Lori Nazura. Deputy Director, thank you so much for being with us.
Thank you so much, Senator, and glad all of you can be here tonight. There's a lot to say, a little time, so I'll just jump right in. First, I'd like to kind of give you an overview of the state's role in this process. California is leveraging its well-established existing immunization framework and its emergency response infrastructure to coordinate between state, local, and territorial authorities to administer the vaccine. So that's the role that CalOES and California Department of Public Health are playing together here. The state's building on lessons learned from previous vaccination campaigns, such as H1N1, and seasonal influenza efforts to prepare and plan for the receipt and the distribution of the COVID-19 vaccine. So this is something that we plan for, and we're executing the plan. In addition, you might say, well, this is a little bit bigger than flu season. Yes and no. CalOES and Department of Public Health have been co-leading a vaccine task force for many months now to work through issues such as the allocation processes, the logistics of distribution, the purchase of sufficient ancillary supplies that go with the vaccine administration, which is like gloves, masks, face shields, etc. We also have to look at IT infrastructure because I think Dr. Brewer talked about it a little, and I will too, about the systems that we use when we do all our reporting, our ordering and our reporting for the vaccine. We'll also talk about communication strategies and just to name a few of the things that the task force is covering. In November, the Department of Public Health announced that it had put together a community vaccine advisory committee. Some of you may be familiar with it. Who knows, a few of our listeners may actually be on that committee. It's made up of over 70 different organizations to ensure equitable access is an integral part of our vaccination operations here in the state. The committee has meetings most Wednesdays, and you can listen in by phone, or you can listen on YouTube. They do a live stream. Another group that you may have heard of, and I believe it was Dr. Brewer that mentioned it a little bit, was the Western States Scientific Review Work Group. So initially it had been set up for the state of California, but then was joined very quickly by Oregon, Washington, and Nevada. So now there's 4 states represented there. And they are made up of science and immunology experts, and they've been independently and simultaneously reviewing the safety and efficacy of the COVID-19 vaccines undergoing approval by FDA for distribution. And then Dr. Brewer talked about Pfizer was approved last weekend. Today, the FDA has recommended approval of Moderna, so we'll find out this weekend probably, and they'll start shipping that. So I just want to emphasize that the safety protocols, even though this vaccine moved quickly, it followed all the protocols, and FDA has reviewed those and approved them. The National Advisory Committee on Immunology Practices has reviewed it. We have our Western States Scientific Review Group that has reviewed it. So we just want to assure the public that all steps have been taken to make sure that, that this vaccine is safe for you. Now, let me give you a 30,000 foot level overview of how the vaccine comes into the state after it's approved. And we have the one that's approved now, Pfizer. Moderna is on its way to being approved. So by next Monday, even, we could potentially see that coming into the state. And then there's 4 more? No, there's 9 total, I think. But 2 more potentially can come online as early as January. So this is kind of, you know, the universe of what we're looking at. And today, Operation Warp Speed, which is, you know, the name that they've given this, the vaccine operations, has said that they would have enough vaccine for every person in the nation, and that those vaccines are free. I want to make sure everybody knows that they're free. Don't let anybody tell you you need to pay for it. So the CDC will give us an allocation, a certain number of doses. And right now we're in vaccine scarcity, which means that they kind of have to be rationed. It's not enough that everyone who wants to get immunized or vaccinated can get one right now. And I'll talk a little bit more about that later. So, so what the Department of Public Health, the State Department, does is they then give a certain number of allocated doses to each of the counties. And then the counties just use the regular system that they would for any vaccine ordering. And it comes up through the local public health officer up to the State Department of Public Health, and then where it's reviewed and sent over to CDC. CDC reviews it, and then they send it to the manufacturer. So in this case, you know, this week it's been Pfizer. And then Pfizer is the one that actually ships direct to the providers. So I'm really running low. So Pfizer requires ultra low temperatures, which is minus 80 degrees Celsius, which requires special storage. And Moderna only negative 20 Celsius. So it's a little bit easier to manage. The companies monitor the temperature of the vaccines through tracking devices within the shipping boxes themselves. And if you imagine, if you will, a large cardboard box like you might get from Amazon, you open it up and you see that it's insulated and there's dry ice surrounding a second cardboard box inside. When you open that up, you find what looks like 5 pizza boxes stacked up, and the doses are inside those pizza boxes. As you can imagine, there's a lot of protocols for storing the vaccine to make sure it stays viable, but I'll stop there. This week, we got our first tranche of Pfizer. The first 5 shipments delivered on Monday, Tuesday and Wednesday, 28 more. And then today, the final 82 shipments were delivered. As I mentioned, we're in vaccine scarcity. So we have to prioritize who gets the vaccines first. And phase 1A is to healthcare workers and residents of long-term care facilities. There's about 3 million people in that group. So that's even further prioritized or broken down into tiers. And I won't take the time to run through them all. If you want to hear them later, we can definitely get that information to you. Phase 1B is after we get through all the healthcare workers and the long-term care residents, then we'll go to phase 1B. And the discussions for that is just now starting. It hasn't been set, but the Vaccine Advisory Committee met last week, and it looks like they're going to recommend that the phase 1B essential workers, the first 3 groups that get vaccinated out of essential workers would be food and agricultural, education and childcare, and emergency services. Whether or not that will be approved with other populations such as the elderly or those with comorbidity has not yet been decided. So all that you should hear more about in the coming week. So I'm going to leave you there. I'm going to give you one website where you can go find all this and more. That's at covid19.ca.gov/vaccines. And you can find all this information there. Sorry for going over. Thank you, Senator.
You're all good, Deputy Director. We appreciate it. That's Deputy Director for the State Office of Emergency Services, Lori Nazura. We're going to ask each of our 3 panelists, if you could please take yourselves off of mute. We're going to be getting into a conversation. We have questions and comments coming in from throughout Northern California. We have about 2,700 folks watching tonight. We want to welcome each and every one of you to be joining us. Thank you so much for our coronavirus town hall. We want to remind folks, if you'd like to be able to ask a question this evening, provide a comment, please email us, senator.mcguire@senate.ca.gov. Questions, comments, concerns, senator.mcguire@senate.ca.gov. We look forward to hearing from you. This is the most important part of tonight. We've asked our panelists to be able to keep their responses to about 30 to 60 seconds because we have so many questions that have come in, and we are so incredibly grateful that they are here with us tonight. All right. First question is going to be going to Dr. Brewer. Dr. Brewer, we're receiving a lot of comments and a lot of concern about the safety of these 2 vaccines. And it's based off of the fact that it was rushed through the approval process. So let's address this head on. Dr. Brewer, number 1, would you take the vaccine? Number 2, talk to us about why you believe these 2 vaccines, Pfizer and Moderna, are safe to be able to take. Please.
Sure. So I'm actually scheduled to get my first dose tomorrow at 1:20 p.m. at Ronald Reagan Medical Center. So in answer to that, yes, I will get the vaccine. Why is it safe? So while we got from virus to vaccine in under a year, unheard of, that actually builds on about 10 years of science and technology so that the platforms to create these vaccines have been existent for years. And essentially what they were able to do is swap out the protein of a previous vaccine, swap in the protein for the coronavirus. That helped to make it go faster. Secondly, both trials had independent data safety monitoring boards. These are experts not associated with the trial. They reviewed all the safety data. Those data were then reviewed by an independent panel at the Food and Drug Administration, and finally reviewed a 3rd time by an independent panel at the CDC, the Advisory Committee for Immunization Practices. So all told, I think we can think that these vaccines are safe. No major side effects so far, except for those 4 cases of anaphylaxis that I mentioned.
Dr. Brewer, Dr. Willis, let's go to the next question. We are being inundated, and is absolutely rightfully so, about questions on the vaccines. So quickly, Dr. Brewer, what is the difference between the Pfizer and the Moderna vaccine? Is one more potent than the other? That just came in from Paul and Kevin as well.
So no major differences between the two vaccines as far as the public is concerned. So they're both messenger RNA-based vaccines. One has a slightly higher dose and is given 4 weeks apart. That's the Moderna vaccine. The Pfizer vaccine, slightly lower dose, given 3 weeks apart. But the side effects and the efficacy are essentially identical. So as far as the public's concerned, you don't have to worry about the logistics and the cold storage. Those are important differences for people handling the vaccines, but for people receiving the vaccine, no big difference between the two.
That's Dr. Brewer from the UCLA School of Medicine. We are so grateful Dr. Brewer is with us. We're taking your questions and your comments on the coronavirus. We're also taking your questions and comments tonight on the vaccine that is now in California. Senator.McGuire at senate.ca.gov. We're now going to go to Dr. Willis. Dr. Willis is the County Public Health Officer for the County of Marin, but he's answering your public health related questions throughout Northern California tonight. So let's go to Judy. Judy asked this question. Advice, and by the way, a lot of parents are concerned about this. Dr. Willis, advice about high schoolers returning to school for spring semester, how to be able to keep them and our family as safe as possible. And when do you believe that students under the age of 16 will be given the vaccine? Dr. Willis, that is a two-part question. The floor is yours.
Yes, so the first question, we've learned a lot about how to engage our school communities for safe reopening of schools. And Marin County, about 90 schools out of our 110 schools are open to some form of classroom-based learning. We have 400,000 student days now accumulated of students in classrooms, and we've learned really that it's about the how. If the practice is in place, the practice and the procedures, we know that we can actually reduce risk of transmission significantly in that setting. We've only had 2 cases of transmission of one person to another within a school setting since September 8th, when we started reopening schools in Marin County. And that goes for elementary as well as high schools. Obviously now with the surges in cases, there's a concern that especially if people travel over the holidays and we would see potentially a surge upon the surge. That's one of the reasons that the governor has indicated that for counties in the purple tier, which is that highest tier, which is virtually now the whole state, and then those counties and those regions that are in the stay-at-home order, where most of the state, except for many on this call with Northern California, is the only region now that is not in that stay-at-home order. The policy for that stay-at-home order is actually that schools that have not reopened to classroom-based learning cannot reopen to classroom-based learning yet. I'll get to the question regarding children. So they have not, the studies did not include, and Dr. Brewer can correct me if I'm wrong, did not include children under the age of 12. So there's still some question marks around what is the actual efficacy and safety of that vaccine for that particular group. We know that if we are able to get everyone, including all the adults vaccinated, the whole community is protected, including our children.
All right, that's Dr. Willis, the County Public Health Officer from the County of Marin. Dr. Brewer, any other items that you want to add to that quickly?
No, Dr. Willis is correct that the studies did not include children under the age of 12. Those have been planned and are supposed to go forward within the next couple of months. So we should have that information over hopefully the next 3 to 6 months.
All right, we're going to go to our next question. Deputy Director Nazura from the California Office of Emergency Services. She's also the co-chair of the Vaccine Task Force here in the state of California. So Director Nazura, we learned tonight, and this is coming in from Bean, who says, tonight we've learned a number of states have had their allocation of the Pfizer vaccine reduced to 30 to 40% of what was projected. Has California's allocation been reduced? So I know that you've been tracking this, Deputy Director Nazura. Let's confront this. Are we seeing a slower flow of vaccine coming in now to California?
The allocation for next week, yes, is lower than what we had originally been told. The first allocation we got was spot on what we were told. So it's a little early to say if it's slowing. It's just an anomaly, and I've talked to people who have been around for the H1N1, and they say the same thing happens. You you get told you're going to get a certain amount of vaccine and then it changes, which is why it's been so hard for us to answer people definitively about how long it will take before we get through phase 1A or phase 1B and before we get to mass public vaccinations. So we are looking at about 1 million doses by the end of this month. We may get as much as over 1 million to 2.6 million in January. So yes, we did get less in the second tranche but the first tranche came in just what they said it would.
All right, that's the Deputy Director from the California Office of Emergency Services, Lori Nazura. We're going to go to a related question now to Dr. Brewer. So what we just heard is we may see a temporary slowing of the vaccine, probably not permanent, coming into California and other states. Dr. Brewer, Carrie writes in tonight, how likely is it that there will ever be a cure? So let's talk about that. And do you believe, Dr. Brewer, this is going to become an annual vaccine that will be required or optional like the flu shot? Dr. Brewer.
So 2 questions there. In terms of a cure, I think that's probably unlikely in the near future, though we will likely see more effective treatments. So there are a number of clinical trials going on looking at both antiviral medicines to specifically target the SARS-CoV-2 virus and anti-immune medicines to protect the body from an overactive immune response. So I think treatment will continue to get better. In terms of how often the vaccine, we'll have to wait and see. This is an RNA virus. That means it can make mistakes when it replicates, like influenza. And as the virus changes, it may need that you have to get a new vaccine. That having been said, measles is also an RNA virus, and you only need to get your measles vaccine twice. So too early to tell whether this is going to be a 2-time or 3-time vaccine or an annual vaccine, but hopefully we'll get that information over the next year.
Let's keep building on this question. We're going to have Dr. Willis chime in on this as well. Dr. Brewer, Dr. Willis, and Deputy Director Nazur are now going to break out their crystal balls. So here we go. And this is coming in from Brenda. Brenda is asking, by what month do you expect all of those who want the vaccine will have it here in California? Dr. Brewer, I know this is a gut, but why don't you give us your best prediction? Then we'll go to Dr. Willis and then Deputy Director Nazura.
I don't think much before May or June. That would be my guess, but it's just a guess.
Thank you, Dr. Brewer. Again, we're very early in on this. Dr. Willis.
My hope is for Marin County that we'd have everyone vaccinated by the end of June.
By the end of June, thank you so much. Deputy Director, again, I know you're looking into a crystal ball here. What's your gut? Do you think we're still going to be immunizing folks later in the year?
I hate to be the one outlier, but I think it depends on a lot of factors that we don't have control over, just like with the dosage, the amount of the doses being reduced next week. So it could be as early as May. That'd be lovely. It could be as late as the end of 2021.
Got it. Deputy Director, thank you so much. Look, open, honest answers. You're going to get the most accurate answers here tonight, and we're grateful for their blunt feedback. Let's go to Al's next question. Dr. Willis, Al asks this: how much of a difference do cloth masks make? Do we need to be wearing N95s? Dr. Willis, talk to us about cloth masks.
Yeah, cloth masks are incredibly effective at reducing the risk of transmission of COVID-19. 95% of the particles that we are emitting that can create infection for others are interrupted by just a simple cloth or paper mask. N95 masks are reserved for those situations where people cannot avoid being in close proximity to people who may be infected, like in healthcare settings. So that's where we're reserving the N95 mask for those particular settings. But cloth masks are an excellent tool. And at this point, I hope just a routine part of our wardrobe. It's just, we should not be seeing people out in public without masks on their faces currently.
And again, Dr. Willis, we're going to go with what you're saying. Your hope would be in Marin County, for example, everyone who wants to be vaccinated is vaccinated by the end of June. but that doesn't mean that we're still not going to have to wear masks for the rest of the year. Talk about that. What is that threshold when we can go back to some normalcy and not be wearing those masks?
Yeah, thanks for that question, because I think it's an important point. That we can't wait for the vaccine before, right now we have to be totally on our A game in terms of all the interventions we've been talking about, because 3 months from now, there's a lot of damage we could do in over 3 months. That's a very long time in COVID-19 time. So the vaccine is not going to rescue us from all the interventions we're recommending right now. Furthermore, once we have the vaccine, it doesn't mean we can stop doing those things. Right now, we know the vaccine is very effective at preventing disease and serious illness, right? But we don't yet know from the trials, because we haven't seen enough time elapse, of whether or not it actually prevents infectivity to others. So as we're working through the community and getting people vaccinated, we're still going to need to take all of those precautions that we're taking now to interrupt transmission. We can be assured that we're going to have less and less risk the more and more people that are vaccinated, but we're still going to have to take those precautions until we're out of the woods mid-summer into fall.
All right, we're going to get to the issue of grocery stores and restaurants. Dr. Brewer, from the beginning of this pandemic, there has remained concerns about how safe, number one, grocery stores are. We've been getting several questions about that, how safe the food is when you get the groceries back home. What do you need to do? Do you need to disinfect this? And then Michelle also writes in tonight, are restaurants to-go food, are they safe? So Dr. Brewer, let's talk about grocery stores in general, number one. Number two, should folks be disinfecting their groceries when they get it home? And look, I know you go out for takeout. Do you disinfect that food? And does it need to be cooked or to be able to feel comfortable? Dr. Brewer, let's hear you.
Sure. So I'm going to be doing takeout again tonight after we're all done here. So let's start with the food part first. So SARS coronavirus does not survive long on surfaces. That's true of most viruses. It starts dying off within hours. Even under optimal conditions on steel in a laboratory or plastic, you can't get it to survive much more than 72 hours. You do not need to wipe down your pasta boxes, just stick them in the pantry. Any virus that would be there will be dead by the time you pull the box out. Just make sure you wash your hands when you come home from the grocery store, and you wash your fruits and vegetables. That's all you need to do regarding food. In terms of risk within the grocery store itself, spread of virus depends on a few factors. So one is how infectious is the person spreading the virus? The second is proximity. How close are you to that person? The third is time. How much time do you spend near that person? And then the fourth is any mitigating factors. Are you wearing a mask? Is there a plexiglass shield between you? How much ventilation is there? In general, grocery stores are relatively safe as far as indoors go because you're moving around, you're not standing next to people for long periods of time. The reason why indoor restaurants tend to be more of a risk is you're sitting down close together for longer periods of time. So you have that time and proximity working against you. But if you're wearing your mask and you're washing your hands when you're getting back, you're probably in good shape.
That's Dr.
Can I add something to that? Yeah, I just want to, we do field a lot of questions around specific potential sources of transmission. Can I get it from my dog? Can I get it from a library book? Can I get it from, playground structure? I think it's important to remember that it's really the 90% of the transmission we're seeing is some things that we already know. The biggest risk is being in close proximity to someone that's not covering their face indoors. If we could stop that mode of transmission, we would be in a much better place. So yes, there may be some small contributions to the total transmission that's happening from some of those other things, but really the highest yield is in avoiding indoor gatherings with people outside of your household.
That's Dr. Willis, County Public Health Officer in Marin County, Dr. Brewer from UCLA School of Medicine. We're going to go back to the issue of vaccines. I can't tell you how many questions we're getting about vaccines. I apologize, but we may be repeating some of the questions just because we're getting so many with folks coming into the town hall tonight. So let's go to Laura's question next. Dr. Willis, is the vaccine effective for people that have already had the coronavirus? That's from Laura.
Yes. So the CDC has determined that those that, including myself, I was infected in March, and I was eager to know the answer to this question, whether or not I should get vaccinated. And I know that I am among those that we should get vaccinated. If you've been infected in the past, the vaccine is recommended, and I will myself get vaccinated when it's my turn. Unlike Dr. Brewer, I'm not as much on the front line, so I'll be in the next phase. But the vaccine actually offers even slightly better immunity than the infection itself. It's one of the real benefits of this vaccine because it's so precise to that spike protein that the immune response that your body makes to the vaccine looks like it's even stronger than the immune response to the infection itself.
That's Dr. Willis from the County Public Health Department in Marin County. Dr. Brewer, we're coming to you. This next question is coming in from Debbie. Debbie says, I've read that the 2-dose vaccine from Pfizer is only effective for 3 months. Is that true? Question number 1. And then the other question that she has, if elder patients in care facilities currently have COVID, can they still receive the vaccine? So let's go to her first question. That Debbie's read that the two-dose vaccine is only effective for 3 months. Tell us the truth, Dr. Brewer.
So Debbie, no, it's just we only have 3 months of data. So there's really been no drop off in the immunity generated by the vaccine so far, and that's very good news. But we've only followed people for about 3 months. And so that's why there's only information for 3 months, but we have no evidence to suggest that the efficacy of the vaccine is falling off at all. So I suspect that it will. And the recommendation right now from the U.S. Centers for Disease Control and Prevention is people do not get the vaccine if they are currently sick with COVID-19. But as Dr. Willis said, if you have recovered from COVID-19 and you are no longer symptomatic, then yes, you are and should be vaccinated, but not while you're currently sick with COVID-19.
All right, that's Dr. Brewer from UCLA Medicine. We're now going to go to the Deputy Director from the California Office of Emergency Services, the co-chair of the state's vaccine task force. All right, so Deputy Director Nazura, we are getting an enormous amount of questions tonight about when, in particular, seniors will be able to receive their vaccine. So again, Deputy Director Nazura, I know that you are not going to be able to provide concrete timeline, but talk to us about seniors over the age of 65. Do you think that they will be in the first few tiers of priority when it comes to the vaccine?
They are being absolutely considered for the first few tiers, just because the comorbidity that goes along with age, as well as the death rates that currently exist for the disease. So they're definitely a high-risk population. Right now, I don't have any information about when or what tier, but our drafting guidelines committee is the one that puts together those priority recommendations, and they're discussed openly at the Community Vaccine Advisory Committee meeting that I told you about that occurs every Wednesday. So tune into that again on YouTube, or go to covid19.ca.gov and you find vaccines, and you'll find when that group meets.
So Deputy Director Nazura, I want you to repeat what you said earlier, 30 seconds on this. One more time, recap how are different populations, whether it's frontline workers in grocery stores, farm workers, seniors over the age of 65, how are those decisions made? Is it the state, the feds? Talk to us about that.
There's a little bit, it's made in the state. The federal groups make recommendations as well. So for instance, we're in phase 1A, which is healthcare workers and long-term care residents. Those priorities were developed here in the state, but they're actually exactly what the feds have recommended as well for phase 1A. And so continuing on, yes, those decisions will be made here in the state.
All right, that's Deputy Director Lori Nazura, who's also the co-chair of the Vaccine Task Force. We're going to go back to our doctors here tonight. Danielle writes in, Dr. Brewer, can someone who's been vaccinated still be a carrier of COVID-19? Dr. Brewer.
So Danielle, we don't know the answer to that question yet, and that's why it's so important, as Dr. Willis said, that we continue to wear our face masks, we continue to stay home when we're sick, do our physical distancing, and our good hand hygiene. So to give you an example, the Salk vaccine for polio did not prevent transmission. The Sabin vaccine did. So the oral polio vaccine prevented transmission. The injected inactivated did not. We don't know yet for the mRNA vaccines which side they're going to fall in. So very important to continue to do those preventive public health measures that Dr. Willis has been stressing.
Dr. Brewer, we're getting a lot of questions about the strength of the vaccine, and there may be some confusion out there. So folks are asking, if you have to get 2 doses, why can't they just get it in one? Does that mean that the vaccine isn't as strong as it should be? There's some confusion out there. So set us straight. Why 2 doses? Why can't we just do it in one? Because it's the Pfizer and Moderna, the 2 vaccines that have now been approved by the federal government. You have to get 2 doses. Talk to us about that. Why?
Sure. So the most important thing we want to make sure right now is that the vaccines work. And so what they're doing is they're giving 2 doses to basically prime the immune system with the first dose and then boost it with the second. It may turn out eventually we can get away with 1 dose, but we would sure hate to only use 1 dose and find out that we needed 2. For example, the HPV vaccines are 2-dose vaccines or 3-dose vaccines. There are now data emerging from Costa Rica, Australia, and other places to suggest that a single dose may be effective. But because we want to make sure it really works from the start, we're starting with that 2-dose vaccine with the priming and the boosting. It may be down the line we learn that 1 dose is sufficient, but we don't want to start there just in case.
We're taking a
Can I add to that real quick?
Go right ahead.
Yeah, just, we want the community to understand that when, if you're in for 1, you're in for 2, because it looks like from the studies that the benefit really is after that second dose. 7 days after the second dose, you really start seeing real protection set in. And obviously one concern is that if people get 1 dose and then are lost to follow up or don't make that appointment for the second dose, we're really not going to have the benefit that we would get from everyone getting both doses.
And just to say, the preliminary data published in the New England Journal on the Pfizer vaccine, the efficacy was about 50% after the first dose, about 95% after that second dose. So as Dr. Willis says, that second dose, really important. Make sure you get both of them.
You're hearing from 2 of the best tonight. That's Dr. Brewer from UCLA Medicine. He is an incredible infectious disease doctor, one of the best public health officials here in the state is with us tonight. That's Dr. Willis from Marin County. Dr. Willis, let's talk about distribution. Then we're going to go to the Deputy Director from the California Office of Emergency Services to talk about distribution as well. Jennifer writes in, where will the vaccine be distributed in each county in Northern California, such as CVS? Or is it going to be distributed via local hospital, another facility? What say you, Dr. Willis?
Yeah, there's various ways the vaccine is going to get into the counties. Right now, the first dose came into the local health department. As I described, we're distributing it to our hospitals. Probably next week or the week after, some of our large multi-county entities like Kaiser, Sutter, those actually have independent supply. So if you're a Kaiser member or Sutter, your hospital, your healthcare provider will be receiving vaccine directly from the state. And then we have another, the CVS and Walgreens has entered into a relationship with the federal government to distribute vaccine into long-term care facilities. So residential care facilities for the elder, skilled nursing facilities, nursing homes, both staff and residents. So there's at least 3 arms there of distribution into your counties, local health departments, healthcare systems, and then pharmacies.
That's great. Thank you, Dr. Willis. Talking about how the state is going to get the vaccine into the general public. Let's finish that question with an answer from the Deputy Director of the California Office of Emergency Services. Lori, what say you?
So I echo what Dr. Willis said. Mainly, we would like folks to just go to their normal healthcare providers and get the vaccine. But if we see large influxes of doses coming into the state and we're able to do mass vaccinations, local governments may set up what we call super sites, where we take a stadium or a large arena and turn that into a super site. So it all depends on the volume that comes into the state.
All right, we're going to stick with the Deputy Director from the California Office of Emergency Services. We got 2 questions that are coming in. Next question in regards to vaccines is this. This is coming in from Martin. Martin, thanks so much for emailing in tonight. Will individuals be notified when the vaccine is available for their tier? So, Lori Nazura, tell us, if I'm on tier 1B, which I will not be, but if I was, how will I know it? And who's going to notify me?
So we're going to rely on a lot of different methods to notify folks that they're up for vaccination. The first may be that it comes through your medical provider. You may get a notice from your local health department or your healthcare plan, your employer, community organizations. Some folks are even going to be vaccinated in their workplaces, so they'll find out that way. And then we'll do blasts out through media, social media, and we'll be doing public service announcements. So hopefully one of those methods will hit you.
So let's keep on this issue of vaccines, Deputy Director, and let's talk about tribal communities. We've heard from some tribes from throughout Northern California tonight. How is the state going to communicate with tribes about when they can start taking the vaccine? How's that going to work?
So first, let me say that all but 8 of the federally recognized tribes are working through the Federal Indian Health Services for their vaccination. So it will be IHS that informs those tribes. For the 8 tribes that have chosen to come in through the state, they have a relationship with their local public health offices, and they will be they'll be just folded into the state plan. The same for those from non-federally recognized tribes.
That's great. Thank you so much. That's the Deputy Director and Co-Chair of the Vaccine Task Force, Lori Nazura, Deputy Director of the California Office of Emergency Services. All right, we're going to head over to Dr. Willis. Dr. Willis, there has been an enormous debate that has been going on across this country about indoor dining and outdoor dining. So Jason writes in, if indoor gatherings are the primary cause of spread, why do we see counties banning outdoor dining? Talk to us about that and why we're seeing counties throughout the state ban that outdoor dining.
Yeah, it's a great question. Right now, the order in Marin County across the across our region, Bay Area region, and in fact, most of the state is the stay-at-home order. And it's called that because basically the strongest message we can offer is that your life should be organized around your household and staying at home. Right now, the most important way to prevent transmission and the surges that are occurring is to really avoid any form of interactions outside of your household, as harsh as that seems, especially coming into the holidays. We know that right now we estimate there's probably between 5,000 and 10,000 individuals in our community who are currently actively infected based on our case rates. So outdoor dining is an invitation for people to gather together across households. They're not covering their faces, despite the fact that it's outdoors. We know the ventilation is better. It's going to increase overall mobility of our community, and we know that there's people closer together, and transmission does occur in that setting as well. We need to take every step we can to put the brakes on right now, given the surges we're seeing.
That's Dr. Willis. He is the Marin County Public Health Officer, talking about outdoor dining and why we see so many counties who are now in that temporary shutdown measure, closing outdoor dining facilities. We are now going to go back to Lori Nazura. She is the vice chair of the Vaccine Task Force. Lori, we are getting an enormous amount of questions, you can imagine, about school employees, right? So I'm going to have you repeat what you said earlier. So does the state plan on vaccinating school employees? And what Lori had said earlier, there is not a final decision that's been made yet on what the second phase of vaccinations, after all healthcare workers are vaccinated, who will be eligible for that second phase? Right now, please correct me if I'm wrong, Madam Deputy Director, you are considering school employees, but it is so important that we get teachers and classified employees vaccinated. Talk to us about that. How do you see that playing into the decision?
So I think we're really close to releasing the phase 1B tier 1 list, and education, people in the education field are on that list. That includes government operations, community-based essential functions, as childcare as well.
That would be in this, if you will, second phase after healthcare workers. Is that correct?
Right, and I'm not sure if I mentioned it before. So we think we can get through the healthcare workers by mid-January, maybe late January. So we would then start on this second group, which includes the education and healthcare, food and agriculture, and emergency services, potentially by the end of January.
Thank you so much. That's Lori Nazura. She's the co-chair of the Vaccine Task Force for the state of California. Will writes in, Dr. Brewer, is it safe for pregnant women to be vaccinated? Dr. Brewer.
So no good data, but the answer is yes. Pregnant women are recommended to be vaccinated. Pregnancy was actually an exclusion criteria for the trials, but it turned out there were some women who were vaccinated. There is no theoretical reason to believe that an mRNA vaccine would cause any problems to the fetus. So if you are pregnant, yes, you should be vaccinated when your tier term comes up.
Another question coming in, a specific issue of an individual who is HIV positive. Are there any challenges with the coronavirus vaccine if an individual has HIV?
So not as far as we know. Again, it was an exclusion criteria. There are some limited data so far, and about 170 people with HIV infection who've been vaccinated. No problem so far. So we are recommending the vaccine for that group as well. But the best thing to do is discuss it with your individual healthcare provider. So anyone who has an immunocompromised condition, whether that's transplantation, you're on immunosuppressive meds, you're HIV infected, best thing to do is make an appointment, talk to your healthcare provider about getting the COVID-19 vaccine.
Dr. Brewer, Dr. Willis, I cannot, I'm not exaggerating. I don't know, 45 questions about getting back to normal life. Look, we have been in this for so damn long, right? Folks are numb. They're hurting economically. We're desperate to be able to go back to our normal lives, to be able to get kids back in school. Let's address this again. Dr. Brewer, then Dr. Willis. In 2021, by the end of the year, are we still going to be wearing masks? Do you believe that we're still going to have to social distance? Let's cover this one more time. When will we get back to pre-pandemic levels and living our life? Dr. Brewer.
So hard to know, but what I would say is really the next couple of months are critical. And so as Dr. Willis has reiterated so many times, if you can avoid those indoor social gatherings, stay at home, wear your mask when you go out, that's going to help us get through these next few months, because we really are stretched to the max in our hospitals right now. I think, as the deputy director said, by the end of the year, most people will have had the opportunity to get the vaccine. And yes, we will get back to a much more normal life, probably by the fall. Whether not before then, I think will depend in large part how good we are at doing those prevention measures that have been so important so far.
That's Dr. Brewer from UCLA Medicine. Let's go to Dr. Willis from Marin County Public Health.
Yeah, this is a great question. And I think we recognize that there's been a lot of harm on both sides of this equation. The economic harm of the closures, the shelter in place, the stay at home now, and you measured against the harm of surges in cases, hospitalizations, and deaths. Where that will change. As we start seeing more people vaccinated, we're going to have less and less risk on the COVID-19 harm side, and we'll be able to do more in terms of opening things up slowly. And if we're practicing physical distancing, we're covering our faces, my hope is that as we have more and more of our community protected, we'll be able to actually relax some of those restrictions in the business community to begin to reverse some of that economic harm. That's where I see the work of 2021 is going to be toggling across that, where we're actually seeing less risk on COVID-19. We're able to do more in terms of our businesses, in terms of our work sector, as long as we are doing everything we can to prevent transmission in our everyday lives.
Dr. Willis, he is the Marin County Public Health Officer. We're taking your questions, your comments for about 15 more minutes. We have over 2,000 strong joining us tonight in this holiday season, focusing on the pandemic, what to expect in Northern California from the coronavirus in the coming months, how we can protect ourselves, and what it means for society in this vaccine. We have two of the best doctors with us. We have the co-chair of the state's task force on vaccines. We are so grateful to the three of them. Let's keep these questions coming in. Senator.mcguire@senate.ca.gov. We're taking your questions, your comments live tonight. Senator.mcguire@senate.ca.gov. If you're watching on Facebook, thank you. Simply put your comment into the comment section. We'll lift it out and we'll make sure that comment question is asked. Let's go now back to Dr. Willis. Dr. Willis, Jillian writes in tonight, once my grandparents have received the vaccine, will it be safe for me to be around them even if I haven't received the vaccine?
The answer is that you should also receive your vaccine. We don't know enough yet about how this vaccine is going to be, in terms of its actual across the population, to have that level of specificity. Obviously, in terms of the protection that your grandparents, your parents would receive from the vaccine, we know it's effective in older patients. We know it's 90 to 95% effective in terms of reducing risk. So that will be a huge measure of security. My recommendation would be to still take that precaution of taking the steps to avoid transmission, but you might feel more secure in terms of meeting them outdoors, having physically distance, and especially a week or two after that second dose they may have received.
Dr. Willis, telling us the truth here tonight on our coronavirus town hall. We're now going to go to Dr. Brewer, an amazing infectious disease doctor. Catherine writes in tonight, Dr. Brewer, she's telling you straight up. She says, tell us the truth about the rollout of the vaccine. I don't trust Operation Warp Speed, and their plan for distribution is full of holes. Dr. Brewer, what would you say to Catherine on Operation Warp Speed, the efficacy, the safety of both vaccines, Pfizer and Moderna?
So Catherine, I understand your concern. There's been a lot of mixed messages coming out around the vaccine, and that's made it very difficult to get a straight handle. What I can tell you is that the Pfizer data have been published. They're published in the New England Journal of Medicine. They came out on December 10th, so I've actually read them. I've gone through them. I can tell you that both vaccines were reviewed by independent scientists when the trials were done. They were then again reviewed by independent scientists associated with the Food and Drug Administration, and finally by a group of independent scientists and physicians associated with the Centers for Disease Control and Prevention. The Moderna trial was done in conjunction with the National Institutes of Health, and Pfizer is a major pharmaceutical company that's been around for decades and has a number of products. So while it seems like it was very fast, part of that is because of the technology available to us. But as far as I can tell, the data are real, these vaccines are safe, and they do work.
All right, let's get into the safety of the vaccines with folks with allergies. Dr. Brewer, Peter writes in, what are alternatives for people with history of allergies in the vaccine? Dr. Brewer.
So there have been 4 cases of severe allergic reaction to the Pfizer vaccine since it's been rolled out. That's not uncommon. Even though trials have tens of thousands of people involved in them, we don't find unusual or rare side effects from them until we start giving them to hundreds of thousands or even millions of people. And so that's one of the things that we learn. If you have a severe allergy, you should make an appointment to talk with your healthcare provider about whether or not you should get the COVID-19 vaccine.
That's Dr. Brewer from UCLA Geffen School of Medicine. We're going to go to Dr. Willis. Dr. Willis, we're going to give you an opportunity to be able to talk about a regional outlook. Gail writes in, Kathleen writes in, what are the projected case numbers from Thanksgiving events and Christmas events? So early on, Dr. Willis, we talked about the worst is yet to come. And we're not trying to be an alarmist, but the worst is yet to come in January, February, and into March because of holiday gatherings, Thanksgiving, Hanukkah, Christmas. So what is your prediction related to hospital load, ICU beds for Northern California? Dr. Willis.
Yeah, I mean, so we're talking about holidays that have been in the past, and then we're talking about holidays in the future. And I'm hoping that people recognize we have control over the future. We don't have control over the past, but we can learn from it. What we learned from Thanksgiving is that it did indeed fuel cases. We had a surge in, as Dr. Brewer mentioned, starting after Halloween, we started seeing a surge up through November. When we look at 5 days after Thanksgiving Day, which was the 26th of November, we saw a spike in cases, and that spike has continued. And we attribute that spike to actually that transmission that would have occurred on that particular day, as people may have been gathered together indoors. So my concern is that if we have similar types of gatherings across households over Christmas, we'll see a surge on a surge on a surge, another amplification. And that's where, since we're already near full ICU capacity, that would put us over the edge. So this is, again, the message is to enjoy your holidays together, demonstrate your love for your friends and your family by doing it remotely.
That's Dr. Willis, Marin County Public Health. We're going to go to Dr. Brewer. Dr. Brewer, here is our next question, talking about PCR tests. And I have you explain those as well. Please explain the wildly inaccurate testing results of the PCR tests, as well as the reasons doctors have been instructed to list COVID-19 as the cause of death on death certificates if they've tested positive for it, regardless for any other probable causes. Now, I'm not sure that's exactly accurate. So Dr. Brewer, set us straight.
So two pieces to that question. So let's start with the testing. So there are a lot of different tests out there. They broadly fall into two categories. One category are tests for the actual virus or a piece of the virus, and that includes the PCR test. Those are the tests we use when someone's sick to find out, are they infected with COVID-19? The second major group of tests are blood tests where we're looking for antibodies and immune response to the virus. Those are the tests we do for studies, public health studies, or to see if someone's been infected in the past. So those are the two broad tests. In general, the PCR tests are the most accurate tests we have for infection right now if they're done as they're designed to do through a reputable laboratory. So the most important thing if you're getting tested is to make sure you're going either through your healthcare provider or a reputable laboratory to get your COVID-19 test.
That's Dr. Brewer from UCLA School of Medicine. We are now going to go to the co-chair of the Vaccine Task Force here in California. She's also the Deputy Director of the California Office of Emergency Services. This next question comes in from Mary Elizabeth via Facebook. Madam Deputy Director, what type of identification is required for vaccination? With surges in the Latinx communities, is there a requirement that they must be documented? There will be a lot of hesitant people afraid of being deported. So, Madam Deputy Director, let's talk about that issue. Then we're going to go to Dr. Willis. Madam Deputy Director.
Well, I'll start with we will not report to the CDC any de-identified information. So we won't be giving away any document, whether or not they're documented or undocumented. That information will not go to the CDC. As far as the identification that they'll show, I think I would defer to Dr. Willis on that as a practitioner himself.
That's great. So Dr. Willis, if an individual who is undocumented comes into a health clinic, for example, are they going to have to show residency? The floor is yours, sir.
No. The quick answer is no. This is, I think we're working on removing any possible barrier to vaccination. It's a no-cost offering. We've done flu vaccinations this way in the past, where we'll set up a an event where it's a come one, come all kind of event and people go through. Obviously, for this vaccine, we'll need to have some sort of identification to know for that second dose. But these lists are not shared with anyone outside of public health. And again, no identified information is shared vertically up through the state to the federal government.
All right, so let's go to our next question. We're going to go to Dr. Brewer and Dr. Willis. A lot of questions coming in about misinformation on vaccines. Mary writes in, how do you deal with misinformation and misrepresentation in COVID conspiracy theories? Dr. Brewer, what do you do about that? It's a big issue in America right now.
Yeah, no, it's a very difficult problem. And I think the best thing, Mary, is to go to trusted sources of information. So ask your healthcare provider, someone you have a relationship with, you trust, who's going to be well informed. The other places you can go are your local county public health departments. These are excellent sources of information, as well as the state website and the CDC. So in general, try to use those trusted sources of information. And I think that's the only way to get around the misinformation. Try not to just pick up random information on the internet. That's where, or social media. I think that's where a lot of the misinformation is coming from.
You're absolutely right. Dr. Willis, what do you do about that misinformation?
Well, I agree with Dr. Brewer completely. I think the first is to trust your doctor more than Google, we learned this from our vaccine work over the past few years. It really, the best place to have that conversation, if you are feeling hesitant, if you are having doubts, and you need to have a conversation with someone, have a sit-down conversation with your medical provider who can help you navigate and who can offer you the best messaging for you and understand your particular concerns. Everyone is concerned for a different reason. And it's really hard for public health to offer just a single generic message that reaches everyone. It really needs to happen in that trusted one-on-one relationship that you have with your provider.
All right, that's Dr. Willis, Marin County Public Health Officer. Ladies and gentlemen, it is now time in the town hall where we're going to do our lightning round for questions. So we have about 5 minutes left. We're going to ask each of our panelists to be able to give us short, succinct answers to these questions. We're going to try to get to as many here in the next 5 minutes. If you have a final question, this is our last call for questions, Senator.McGuire, Senator.McGuire@senate.ca.gov, Senator.McGuire@senate.ca.gov. Last call for questions. Let's do this, Dr. Willis. Here we go. This comes in from Julia. Lightning round for questions. Can seniors in nursing homes refuse the vaccine?
Yes.
Look at that. There we go. What is the process to do that, Dr. Willis?
So it's informed consent. So anyone who is a resident of a nursing home, we're working on making sure that they all have informed consent through their provider or through family members if they're not able to make that decision on their own.
That's going to go to Dr. Willis. Dr. Willis, again, is any of the increase of virus cases connected to the testing in false positives? Is any of the increase in virus cases connected to the testing in false positives? This is coming in from Ariel.
So false positives are rare. We're not, and I'm not sure I fully understand the question.
Why don't you explain the false positive real quick?
So a false positive is someone who tests positive, the result comes back positive on the test, but they were not in fact infected. That happens very rarely, and if it does, that person is not in fact infected, so they would not be infecting others. If it's a true positive, then we're concerned about that person, and we would do the contact investigation and help them out.
And we've heard from our president that the reason why we're seeing so many new virus cases is because we're testing more. Is that true?
That's partly true, but the fact is that the test doesn't create the infection. We know that the CDC estimates that there's probably about 6 times more people who are actually infected than test positive, because not everyone has symptoms, not everyone's getting tested, and that's why we need to make sure that we're presuming that anyone around us might actually be infected, because the number of people infectious in the community is probably 6 times the registered rate in terms of reported cases.
Wow. Thank you so much, Dr. Willis. All right, Dr. Brewer, Laura writes in. I know we've talked about this, but we keep getting a lot of questions on this. How effective is the vaccine for someone that has already had the coronavirus? Dr. Brewer.
So Laura, we don't know for certain because those people were excluded from the trial, but the limited data suggests it should be every bit as effective in people who've been infected before as people who've not. And as Dr. Willis mentioned, it looked like the vaccine actually generates higher levels of protective antibody than occur with natural infection. So I would assume it's going to be 90–95% effective in people who have been infected before.
Dr. Brewer, we're getting a lot of questions about how long the vaccine will last in your body. I know you talked about it before. Let's hit it again before we end the town hall. So Judy writes in, how long is the vaccine expected to last? Will we need it every year? What say you, Dr. Brewer?
So Judy, I think what you're referring to is how long will protection last? And we don't know that yet, but the evidence so far is there is no dropping off in protection after 3 months. And so every reason to believe that that will continue for a longer period of time. We need to do the studies. The second part is how long does the actual vaccine last in your body? Very short. Messenger RNA is rapidly degraded by the body. So the vaccine itself won't remain in your body, but the protection will.
So Dr. Brewer, if we get the vaccine in 2021, is the likelihood high that we're going to have to go back in 2022 to be able to get another shot?
So no way to know, but I think probably not, because SARS coronavirus does not change as rapidly as influenza viruses. So I'm hoping that we won't have to get it every year, but no data to tell us one way or the other so far.
Thank you so much, Dr. Brewer, UCLA Medicine. We're down to our last few questions. We're now going to go to Dr. Willis. Dr. Willis, Daryl writes in, ICUs are almost full. What happens to someone who needs an ICU bed if the units are full?
Yeah, so the hospitals are elastic in some way. They're able to actually increase capacity. So they would find ways to make sure that patients who need critical care can access critical care. The steps they might take are staff taking double shifts, moving medical surge beds or not conventional ICU beds and converting them into ICU beds by adding ventilators to those settings, canceling elective procedures so that it can bring staff into that. There's a variety of surge-related operations that can increase ICU capacity before we would have to begin to transfer patients out to other regions.
All right, Dr. Willis talking about ICUs. I want to talk about this issue because a lot of folks are asking how they can spend time with their family over the holidays. So we're going to take Rosemary's question. It is reflective of several that we've been receiving. Dr. Willis, I want you to kick us off, then we'll go to Dr. Brewer. Rosemary says, my pod is my daughter and her family in Sacramento. I live alone and self-isolate, and so do they. I rarely see friends outside, and when I do, I'm masked and at a distance. They are lucky enough to work from home, her kids, and the kids also attend school on Zoom. How can it be unsafe to share the holidays with them? Dr. Willis.
I mean, this is such a hard question because we want to be together over the holidays. Unfortunately, we know that when it is not a clear firewall between ourselves and the rest of the community. Right now, again, there's probably 6,000 individuals infected just right now in Marin County, and never mind the rest of the region. And so the safest thing that we can do is to just hold the line for a little bit longer and obey unfortunately, the regulations of the stay-at-home order, which prevent gathering from anyone outside of your household.
Dr. Brewer, let's comment on that as well. Look, even if folks are safe, they should, unfortunately, stay home by themselves with their significant other over the holidays.
That's exactly right, because we actually have more interactions than we realize. We go out to the grocery stores, we go to the pharmacy, so even the individuals who think they're staying at home and not interacting with other people, they actually are. And so that's why Dr. Willis's point is so important.
Dr. Brewer, these are going to be our last three questions. Here we go. Kathy writes in, is a freshly vaccinated person a potential super spreader as they shed the virus?
No, because we're not actually vaccinating with the virus. We're actually giving a piece of code that your own body cells then translate into a protein. So at no point do you ever actually have the coronavirus in you. All you have is a little part of the virus called the spike protein that generates the immune response. So it is not possible to transmit this virus from the vaccine. This is not a virus-based vaccine.
And a follow-up on that, Dr. Brewer, how long once you receive the shot will you start seeing it being effective?
So it starts to look effective about 12 days after the first shot, but as Dr. Willis said, it's critically important to get that second shot. And we're seeing about 1 week after the second shot, you're probably getting that full 95%. So make sure you get both shots, but you start to see a difference after about 12 days.
All right, this next question is coming in from Ronnie from Marin County. Dr. Willis, is it true that Marin County continues to allow elective surgeries? If so, can you explain the wisdom of continuing to allow elective surgeries?
Well, elective surgeries are important for people's quality of life and in terms of their health itself. I mean, if you're talking about someone who's unable to walk because they need a knee replacement, it's not something we would do lightly to cancel elective procedures. That's a step that is further down the road and is available as a resource if we need to mobilize those assets and bring them in for critical care, but we're not there yet. And our goal is to prevent that from ever needing to happen.
Final question for tonight. We want to say thank you. We're going to have closing comments from each of our panelists here in just a moment. We want to say thank you. Over 2,000 folks have hung with us now for the last hour and a half, and we are so appreciative of you joining us here tonight. Last question, we'll go to Dr. Brewer, UCLA Medicine. It's coming in from Barb tonight. Barb asks, if a person is infected with COVID but is asymptomatic, how would the vaccine affect them?
So if you got the vaccine and you were asymptomatic and didn't know it, probably would not cause any problems. In fact, it probably would be a boosting of the immune system depending on where you were after the infection. But right now, we are not recommending screening for infection before getting the vaccine because as far as we know, no risk. But if you are sick, talk to your healthcare provider before getting vaccinated.
That's great, Dr. Brewer. Dr. Willis, anything you want to add to that?
No.
All right, there we go. Hey, we are going to take closing comments from each of our panelists. Let's start with the Deputy Director from the California Office of Emergency Services, also the co-chair of the Vaccine Task Force. And Deputy Director Nazura, we've had a couple of emails in. If you could repeat the website as well in your closing comments. Folks are just asking for the website again. Deputy Director, thanks for all your work every day on behalf of California. Whether it's a pandemic or a fire, we can count on the Deputy Director and Director Girladucci, who does such a fabulous job for this state. Deputy Director, the floor is yours for closing comments.
Thank you, Senator McGuire, for inviting me, for the two doctors here from whom I learned so much tonight. I appreciate your comments. Our governor has released the Vaccinate All 58 program. You can find out more about it on covid19.ca.gov. And honestly, the program is devoted to both the equity and the safety of vaccinations for all Californians. So please be patient with us as some of the things are out of our control, like the number of doses that are available at any given time. But know that we are working very hard to expedite the process so that everyone who wants to can get vaccinated. Thank you.
Thank you. That's Lori Nazura, Deputy Director of the California Office of Emergency Services. Thank you so much, Lori. We're now going to go to Dr. Willis, the Public Health Officer in Marin, for closing comments.
Yeah, thank you. I think, one of the silver linings of this whole pandemic experience has been how it's strengthened relationships across our community, between public health, between law enforcement and our hospitals, our business sector. We have come together in ways we never have before, and those bonds will be enduring, and I think will make us stronger next year and forevermore. And I also want to thank our elected leaders for convening forums like this. I think at the end of the day, this is the only way we're going to navigate this problem. It's really just being as truthful as we can, as transparent as we can, and describing what's occurring, and even having the humility to recognize that sometimes our decisions have to change, but we have to be flexible. We just learned that we're not getting quite as much of the Pfizer dose as we thought we would. We're used to this now. We're flexing and we're working together. And so I'm inspired by the way our communities have come together on this. We just need, a few more months, maybe 3 months more of really the best behavior we can all have in terms of reducing transmission. The vaccine is on its way. It just started yesterday in Marin County, and we're starting to get more and more people vaccinated. We're going to get out of this together.
Dr. Willis, thank you. We are so appreciative and incredibly grateful of the service that Dr. Willis has been providing, working enormous amount of hours each and every month, day after day, to be able to keep our community safe. The vaccine landed in Marin County today, in Mendocino County today, 2 days ago in Humboldt County. It's on its way to Trinity County and Del Norte County. It's in Lake County and Sonoma County. We are so grateful to all of our public health officers, our frontline healthcare workers. And speaking of that, we want to say thank you to Dr. Brewer. Dr. Brewer, I sincerely mean this. You have been with us from the very beginning. You're cool, you're calm, you're collected, you're able to deliver challenging news. Your bedside manner is just fantastic. And we're going to turn it over to you for closing comments.
So 3 comments. The first is, while you're waiting for the COVID vaccine, if you have not gotten your influenza vaccine, please do so, because we are going into flu season. Second is, if you have any concerns about the COVID-19 vaccine, please reach out to your healthcare provider and make a time to talk to him or her so that you can make sure that all your questions are answered. And finally, I just want to thank everyone, because I appreciate how difficult that has been for all of you, but it really does make a difference. We have been able to dampen the surge before, and I think that we can do it again, and it will bring us together, as Dr. Willis said, as a community. So I think we will get through this as we have in the past.
Dr. Brewer, we are so incredibly grateful. Thank you so much for joining us tonight, as always, for being so accessible, along with Dr. Willis and Deputy Director Nazura from the California Office of Emergency Services. Look, we continue to see record infections in the state of California, day after day. We anticipate that we're going to continue to see this through the holidays, and in particular in January and February. We all need to be able to hold strong. We're going to get through this, as Dr. Brewer said, but we need each other now more than ever, putting aside any differences that we may have to be able to work with each other. And especially in this holiday season, we all need to remain vigilant. We're going to ask you, and I know this is a big sacrifice, we're going to ask you to be able to not gather in groups, to be able to keep that 6 feet of distance, to continue to wear masks. I know that many of us are numb and many of us are hurting financially, but we're going to get through this. We got about 3 more months of some real challenge, but I promise you, we're going to get through the other side, and that light at the end of the tunnel is growing brighter each and every day as the vaccine is distributed throughout this state. I also want to say thank you to several folks who helped put tonight together. A big thank you to Carrie, to Taylor, to Summer, to Dana, to Jason Lyles for all of their work to be able to put this event together. We are so incredibly grateful. A recording of tonight's event is going to be online at sdo2.senate.ca.gov. A recording of tonight's event will be available at sdo2.senate.ca.gov. On behalf of all of us here on the panel, we wish you a happy Hanukkah, a Merry Christmas, and here's to better days in 2021. Thank you so much for joining us tonight. Stay safe and stay strong. Thanks, everybody. Thank you so much.